Hey guys, how are you all? Welcome back to MedSteps YouTube channel. So today in this video we are discussing about wrist bones and injuries. So this episode will be 8 in first aid series. Okay, so today we are diving deep into the wrist bones, and we are going to discuss some amount of anatomy and common fractures and dislocations, complications and management of wrist bones. So by the end you will understand this topic from basic to advanced, and this is very important for medical students. Okay, so first of all, basic anatomy. Let's start with 8 carpal bones. If you are seeing this image, this is wrist part. In this wrist you can see some carpal bones. Total we have 8 carpal bones. These bones form the wrist and are arranged into 2 rows. Okay, here this is here you can see radial bone and ulnar bone. So from here you can see this is the proximal part of the wrist. So if you are seeing the from lateral to medial, from here lateral to medial, if you are seeing here you can see total 4 carpal bones. Okay, that's like scaphoid, lunate, triquetrum and pisiform. These things will comes in proximal area. So this is proximal row of carpal bones. Okay, so if you are going up, if you are going superior side like this, then it will comes like distal row of carpal bones. You can see from lateral to medial. In lateral you can see trapezium or trapezoid, capitate and hamate. We will discuss this each bone and in deep. So before that we have to understand the basic anatomy. So that's why I am going to discuss these things. Okay, so first of all, this carpal bones, total we have 8 carpal bones. Okay, in these 8 carpal bones we can see we can divide into 2 parts. One is proximal row. In proximal row total we can see 4 carpal bones, like you can see lateral to medial. Okay, first of all, scaphoid. Scaphoid bone is very important because this is the most common and most fracture bone. Okay, most commonly occurs fracture in wrist, that is scaphoid fracture. Okay, and in this scaphoid fracture we have to take attention about avascular necrosis. Okay, so that's why this is very common. Next one, lunate. In lunate most commonly you can see dislocation, and it can cause carpal tunnel syndrome also. So that's why it's very important. Next we can see triquetrum, carpal bone and pisiform. I already showed this image. If you see this here, this is scaphoid bone, this is lunate, and this is triquetrum, this is pisiform. Okay, now we are going to discuss about distal row of carpal bones. This thing also same to same, lateral to medial. We are going to see how many bones we are seeing. 4 bones. Okay, so in these 4 bones, first one we are going to see the trapezium, trapezoid, capitate, hamate. These names are very difficult to pronounce. How we can remember means we have one great mnemonic. That mnemonic will be so mnemonic. Mnemonic will be so long to pinky. This is proximal row carpal bones. Okay, next one for distal, here comes the thumb. This is medial to lateral. Here you can see that bones will be like lateral to medial. What are the bone scheme? S means scaphoid, L means lunate, T means triquetrum, pinky means pisiform. Okay, here medial to lateral, mnemonic. H means hamate, C means capitate, T means trapezoid, and T means trapezium. So this mnemonic will help you to remember the order starting from the thumb side. Okay, so this is the mnemonic. So now I am going to highlight every carpal bone, like important carpal bones. First bone, that is scaphoid. You can see here, this is scaphoid bone. Okay, now I am going to discuss about scaphoid bone. I am not going to like in deep, but what are the main features these bones have, that thing only I am going to discuss. Then after we will discuss pathological condition. Okay, this is scaphoid. In the scaphoid bone, you can see this is most commonly fractured carpal bone. I already mentioned this point. Fractured carpal bone, especially this fracture will happen because of fall on an outstretched hand. Fall of an outstretched hand, and you can see you can palpate it in the anatomic stuff box. Okay, so this is the main things for scaphoid bone. Next, lunate. In lunate, mostly we have to know that it's very prone to get dislocation, and it can compress the median nerve. Because of dislocation, it can compress the median nerve. If any person getting median nerve compression, then we have to think about acute carpal tunnel syndrome. Okay, next one, hamate. This hamate also called hook of hamate fracture, but it's lead to ulnar nerve injury. It's very rare, but we have to know this thing. Okay, so if we are going to first aid, then in this first aid, if you are seeing first aid, you can see this type of image. In wrist bones we already discussed, and we discussed the mnemonic also. And scaphoid palpated in anatomic snuff box is commonly fractured carpal bone, and typically from outstretched hand, and is prone to avascular necrosis and owing to retrograde blood supply. These things I will explain in deep when we are discussing about fracture and these things. Okay, so in X-ray you can see this type of image. Okay, so in X-ray we can easily find out any dislocation, any fracture, and any compression of the nerve. Easily we can find out these things. So now we are discussing about lunate dislocation. In lunate dislocation, it's like why this dislocation will happen, because of mechanism of like fall on an outstretched dorsiflexed hand. In clinically we can see some wrist pain and the swellings, decreased grip, and median nerve symptoms like tingling, numbness in lateral 3.5 fingers. In radiologically, in X-ray, in lateral X-ray we can see like a spilled teacup sign. Okay, still teacup sign. So you can see here. So and in the lunate will appears like little tilted. If you are seeing this image here, this bone got tilted, so that's why we call that is spilled teacup sign or tilted. That lunate bone will be appears like tilted forward. So what we can do in management? In management, in management we can do like immediate reduction or surgical stabilization if unstable patient, and we can monitor for medial nerve injury. Okay, next one we are going to discuss about scaphoid fracture. This scaphoid fracture is very important, that's why I'm going to take little more time in scaphoid fracture. This scaphoid fracture, mostly this we can see this is the largest bone on proximal carpal row and is located off the radial aspect of the hand, just distal of the radius itself. So in carpal bones, the scaphoid fracture is the most common. In mechanism of injury, if you are seeing, means that patient, if any patient fall on an outstretched hand with wrist hyperextension, then in that patient we can see this scaphoid fracture, and that pain is localized in the anatomic snuff box. If you are palpating, that patient will get pain, and that wrist pain after a fall. Okay, why is this important? Because in this scaphoid fracture, if you are seeing this image, in this scaphoid fracture we can see here the blood supply enters distally and flows proximally. Okay, so that means here scaphoid fracture happened here, and if you are seeing this image, but in blood circulation, you can, if you are seeing this blood circulation, the blood circulation is coming from distally to proximal. Okay, so the blood supply enters from distally and flows proximally in a retrograde fashion. If a fracture can disrupt this supply, so it can lead to a vascular necrosis of the proximal pole. So that's why this is very important fracture. Okay, in X-ray you can see this type of image. This is the fracture happened here. Actually this bone will be like this because of fracture that displaced. Because of the displaced, we can see because of that compression and avascular necrosis can happen, the retrograde fashion. Okay, so how we can diagnose this fracture? We can easily diagnose it with X-ray, and it's like might be normal. If any patient getting tenderness and we have to persist and we have to do immobilize with a thumb spica cast, we can apply the thumb spica cast, and we have to repeat imaging after every 10 to 14 days. Okay, if in X-ray we are not seeing anything, means then we can do CT scan or MRI, can detect occult fractures in early. Okay, if displaced, then we have to do surgical fixation with screw fixation, may be required to avoid non-union or avascular necrosis. Okay, so these are the things will comes in scaphoid fractures. Next one, hamate fracture. If you are seeing this hamate, this fracture, this bone. Okay, in this bone mostly this is like hook of hamate fracture. This is very common in athletes, because if any person like holding a bat and a racket or club and playing like over repetition movements, this is presents with pain over the hypothenar eminence, may have like ulnar nerve symptoms. It's like because of this thing, the patient complains that weak grip and sensory loss in medial 1.5 fingers. So for this thing, what we can do? We can do management like non-displaced, or we have to use splinting, and displaced or symptomatic non-union or surgical excision of the hook. Okay, so next one, metacarpal neck fracture. This metacarpal neck fracture is also known as boxer's fracture. Okay, so in this boxer's fractures, what will happen is usually involves the fifth metacarpal neck. You can see this image here in X-ray. It caused by punching a hard object or because in boxing, so you can see this type of things. Okay, and the patient will in patient we can see clinical features of swellings and tenderness or over dorsal hand. So in management we have to do acceptable angulation up to 40 degrees for fifth metacarpal, and we have to do immobilize with an ulnar gutter splint, and we can do surgery if severe angulation or rotational deformity. Okay, so in summary, I'm going to give little brief about this wrist bones and injuries. In scaphoid fracture we can see snuff box tenderness, and risk of avascular necrosis, and that for that patient we have to use thumb spica splint. In lunate dislocation, that median nerve compression will happen, it will lead the median nerve compression, and we can see like spilled teacup sign, and we have to do urgent reduction. In hook-up hamate fracture, ulnar nerve symptoms may need surgical excision, and in boxer's fracture, fifth metacarpal neck or splint or surgery if severe. I hope this clears up wrist injuries for you. Let me know in the comments if you want me to cover other fractures or musculoskeletal topics. Don't forget to like, share and subscribe. If you found this video is helpful, so you can share this thing, and if you have any doubts you can ask me in comment section. Take care, bye bye.